Hi, my name is Kwok. I am a cardiologist in Toronto. We explored Cambodia for the first time in 2018. We chose Cambodia because we wish to focus our efforts on places where the need is greatest and our resources can meet those needs. Cambodia is a rapidly growing country but still underdeveloped in many ways. The healthcare system has many challenges. The standard of living is low. Malnutrition and infectious diseases like TB, malaria, and dengue fever are still common causes of death. At the same time, chronic diseases like cardiovascular diseases and diabetes is on the rise as the country becomes more modernized. Life expectancy, although improved, is still far below developed countries. The majority of the population has difficulty accessing or affording their health needs. In addition, there is huge inequality in healthcare access, especially outside the big cities. To address the healthcare issues in Cambodia, it is much better to train local medical students to be better doctors because they speak the language and understand their own culture. Through a local mission organization, we were able to teach medical students in a local university. We gave lectures and organized interactive workshops for 1 week. Students were very impressed about our interactive style of teaching. They were keen to find out about the North America way of doing things. Some students rated that week of teaching session as the best they ever had. We were also impressed by the students' sincerity, their enthusiasm, and their appreciation. After lecturing in medical school, we spent a few days conducting free clinics in several villages around Phnom Penh. We saw patients and gave out free medication. One of the locations we set up free clinics was a Buddhist monk monastery. We worked in the intense heat and sometimes outdoor. Coming from Canada, it was difficult to tolerate the hot weather physically, but all the team members worked with a joyful heart because we know we were serving God and the local people. We could tell from their facial expressions and gestures that the villagers appreciated our presence very much. One of the things we treasured was that there were 5 students that we taught from the university came with us. Because we don't speak the local language, they help us with the interpretation, and in turn, we gave them one-to-one clinical teaching. We got to know them particularly well. We talk about medicine, but much more than medical knowledge. We talk about their aspiration, we talk about faith, virtue of being a good doctor, and lives in general. We could see their lives were impacted by our presence. When pandemic hit, our trip in 2020 was cancelled, so we moved to providing virtual lectures that were well received. Other MS teams were teaching nursing students in the same and different universities. We share resources and personnel with other MS teams like MS China South Team. We anticipate another session of virtual teaching next February or sooner if other teaching opportunities arise. We wish to travel to Cambodia again when travel restrictions ease, so that we can teach in person, to conduct more free clinics, to work in mission hospitals, and to explore further mission opportunities. We need physicians of all disciplines, dentists, nurses, pharmacists, and other health professionals so we can form a pool of lecturers to meet the needs of medical, dental, nursing schools. We also need healthcare personnel interested to provide free clinics to local people, especially in places outside the cities where the need is greatest.